Anna Piątek, I represent Asseco, the leader on the healthcare IT solutions. We are making original IT solutions benefiting several dozen hospitals in Poland, as well as tens of outpatient clinics. I started with facts and figures on purpose because in challenging times of pandemic, which are challenging for the patient or everyone and medical professionals, we, as software provider, feel even more accountable. We want to make solutions that have an impact on efficient operations of so many medical institutions we collaborate with. I'm going to tell you today about a solution which expands the functionality of e-appointments. It's teleconsultation. This is a service that benefits hospitals and medical outpatient clinics. Okay, what is teleconsultation? Because in recent months, I'm sure many of us have benefited from them. This service is very often delivered over the phone, and I want to stress that we went a step further. We provide our client a tool that enables medical professionals to see and talk to the patient. So it's a set of tools, it's a toolbox with audio-visual capabilities, and this service makes it possible to remotely deliver medical services. Well, while creating this functionality, we wanted to make sure that this consultation will be very similar to consultations in real life, which we are all used to. The only difference is that the physician is talking to the patient over the microphone, over the camera. So during remote consultation, we wanted to ensure that the physician and the patient can interact with each other, hence the video functionality. And this helps the physician to make the right diagnosis, and it also plays a vital psychological role when interpersonal interactions are so scarce. Patients want to have a sense that it's not another telephone conversation. They want to have a sense they are in deft hands. While such consultation lasts, the physician has full access to patient records, medical records, data from previous appointments. The physician is able to produce an electronic prescription. So all those functionalities are available and tied together. Another important feature of our solution is simplicity. We wanted to reduce complexity to bare minimum. We wanted to make e-consultation as simple as possible and easy to settle, which is why the patient doesn't have to download software, doesn't have to log in. The only thing the patient must do is have a computer or a smartphone with a browser. To launch the service in a hospital or an outpatient clinic, there are no costs involved. You don't have to buy or lease additional infrastructure. This solution can be implemented at the client's, within the client's organization, within affecting calendars, schedules. There are no additional training events required for patients and medical professionals alike. So it's simple, yet intuitive. Another important aspect that we have taken into consideration, and I want to stress, is safety. Well, this service, we don't store, we don't record or save personally identifiable information. The only information flow is between the patient and the physician. Data are encrypted, and the resources which are used to share the service are based in clouds which are safe. Asseco is collaborating with the national cloud, so it's a cloud-based or national cloud-based solution. What guarantees top-notch security? So let's continue because I want to show you how it works in real life. Okay, so let's start with stage one. It's usually when you have a scheduled appointment, there is a reminder sent to the patient. In case of teleconsulting, we send the reminder by text or another channel indicated by the patient. So in addition to information that the appointment is coming up, gets information that it's going to be a remote consultation. This message also contains information that patient will receive an invitation on his or her smartphone for the appointment. The message contains another link to rules and regulations of the service. So each time the patient must confirm and accept all its provisions. Okay, the next step. So let's assume that's the day and when I have the medical appointment. The physician initiates the consultation mode to initiate the meeting with the patient, meeting that the module is activated by the medical professional, what means that the appointment starts, and it's the physician who also ends the meeting. So what happens later? Well, okay, so the patient has been invited by the physician for teleconsultation and receives a text message with unique link to the virtual room where the appointment is held. So you click on the link, the browser opens, and your teleappointment begins. Okay, so that's the virtual room. Consultation has begun. I've said right at the beginning that it's very beneficial for the patient and the physician is that both they can see each other, and they can also control the availability of audio and video channel, so you can switch off the camera anytime. Well, the virtual room where you have teleconsultation fits two people. The only people that can join the physician is an individual who previously received a unique link. So we guarantee that only the right people will be attending the appointment to ensure discretion and privacy. Well, the physician on the other side may not connect to the patient, but to the caretaker, for example. It's also possible. So messages traditionally sent to the patient are redirected to the caretaker, and the caretaker will receive the link to the virtual room. I would like to highlight sorry, caregiver, not taker. So while designing this tool, we wanted to achieve two things: simplicity and safety. Simplicity for the patient and for the physician. Safety because we comply with requirements of personal data processing, and the service itself is delivered in very safe cloud-based environment. And what marks our difference is the audio-video conversation between the patient and the physician. The physician has ultimate access to all functionalities of the system. And last but not least, I want to stress that teleconsultation, the service I was presenting today, I hope I've managed to get you interested in it, is an element of our anti-COVID package. This is not the only functionality we have designed to support healthcare in times of pandemic. It's available on our MMS portal. You can see the link on this slide, and it's available in 3 versions. So that's everything from me. Thank you very much for your attention. And of course, I encourage everyone to get in touch with us. Thank you.